We're going to take a quick look today at a red wedding episode of Game of Thrones in which private practices are completely annihilated. Let's take a look. Okay, so here we are at the financial simulation model page and we are going to follow the realistic scenario. We have a network with 100 PCPs, 1,000 patients per PCP, attribution rate is 80%. The annual total cost of care is $10,000 per patient, and we are going to try to achieve 5% in savings. And we have to hit at least a minimum of 1.5% in order to get any shared savings. So let's see what the opportunity is. So for 800 million total cost of care, 5% is approximately $40 million, and the ACO can potentially get $20 million. And for 100 PCPs, that's approximately $200,000 in money that you can potentially receive in bonus. So where's the red wedding scenario? Let's go ahead and let's take a look. In order to run an ACO, you need money. You need funding for data analytics, caregivers, and a lot of other things. Also, there's PCP burden because you're going to be performing a lot of non-billable tasks and you need more staff to do that. In our case, the ACO funding is approximately $2.1 million and the PCP burden is $57,500. You take that up to 18 months. By the time everything gets reconciled, you need approximately $3.1 million and PCPs are already $86,000 in the hole. And for that, you need money. And so in this case, we are going to go use the payer advance. So the payers are going to sponsor or give money to the ACO to jumpstart the ACO. In this case, they're going to give us $10 per member per month. But if you don't hit your targets, they're going to sort of take back 75% or $7.50 per member per month that they gave. And then the following year, even if you hit the target, they're only going to give you 75% of $10. So because they're going to ratchet 75% because the whole point was to jumpstart the ACO. So you're going to get $800,000 per member per month, which is approximately $14.4 million. So where's the red wedding scenario? Well, if we end up missing the target, let's see what happens. ACO gets $0, but the ACO is owed, the physicians need to give back $10.8 million to the payers, but they were already $86,000 in the hole. So they are now in the hole for almost $200,000. So you went from potentially getting $200,000 to now losing $200,000. All independent primary care physicians in the ACO are in the hole for approximately that much amount of money. Enough to wipe out all of these practices and send them into the arms of large health systems or the payers themselves to become consolidated, which then will increase the total cost of care. Thank you. Goodbye.